Hartford HealthCare has declared the month of May as HealthCare Heroes Month, and a salute to the thousands of individuals who are working tirelessly to deliver the best care in these challenging times. Shannon Rattrey is a nurse at Hartford Hospital who has been key in the care of COVID patients during the pandemic. Sharon, welcome.
Hello, good morning.
Great to have you. So tell us about your role as a clinical nurse leader.
So I'm a clinical nurse leader on Bliss 5 East, which is a vascular, thoracic, and trauma unit. So anything to do with the plumbing of the body or any surgery required in your chest cavity, that's where you would come. My role as a clinical nurse leader on the unit is to coach, mentor, and educate our newer nurses as well as like our patient population and things of that nature.
Wonderful. All right, patients in your department shifted during COVID. How did you prepare yourself and your colleagues?
I would be a liar if I said that I wasn't as nervous as my peers, but I took the time to make sure I researched the population and COVID as much as I can, so I was able to disseminate that information to the other nurses on the unit, so that hopefully if we felt comfortable taking care of this population, we would do a better job at that.
Oh, such heroes, you all. We understand you are very active in your community as a nurse. Why do you think that's important to do?
Building rapport with the community is always important because it allows us to strengthen and build those bonds and relationships that we have, which makes educating them much easier, helps us to have better patient outcomes.
All right, we read that you aspired to be an actress before pursuing your nursing career. Are there any similarities in the two?
I can say that there are. As soon as you hit the door of Hartford Hospital, you put on or you put away what you have going on in your life, because let's say that anyone going to the hospital, it's not going to be the best time of their life. So you want to be able to be as happy and jovial as you can and be a support there. So sometimes you may be a comedian at that moment, or maybe you're in a cute rom-com because you have this 9-year-old couple who's telling you about how they met. So there's different faces and different hats that you put on. So I will say that there are a lot of similarities between the two.
That is so true. I never would have thought of that. All right. What about your advice to people who might be considering a career in nursing?
I would say that it's a wonderful and amazing career. You are there to not only educate the community, but you're there to be there at some of their lowest and worst moments, to be that light in their life at that moment.
Oh, well, Shannon Rattrey, thank you for all you do, and thanks for being with us today.
Thank you so much for having me. You have a wonderful day.
You too.